Assalamualaikum. So today I'll be teaching the final subtopic of pain, which is managing and controlling pain. Now, as we all know, there are different methods to relieve pain. From your homework, you've written down yoga, so I'm guessing that is to relieve back pain. Music, there's also drugs. Some of you have written down massages, which is considered traditional. So today, we're only going to look at three methods which are in your syllabus, which is medical techniques, psychological techniques, as well as alternative techniques. Now, the first one is medical techniques. Under medical techniques, there are surgical treatments, there are physical therapies, and biochemical methods. But we're only going to look at biochemical methods because this is the one in the syllabus. So under medical techniques, it's only biochemical methods. But I will also go through surgical just to give you a hint of what it's all about. So surgical treatments. Okay, so if you're in pain, and if it's dangerous, they would have to do surgery, such as removing appendix, cataract surgery for your eyes, cesarean section if you're giving birth, as well as a bypass for your heart. Okay, now in terms of physical therapies, it includes therapies such as massages, mechanical therapy such as ultrasound. Now, how does ultrasound work? I know you know that it's only used for if you want to have a look at your baby in your tummy. Excuse my voice. But it can also be used to relieve pain. How? The sound wave from this ultrasound can somehow treat joint pain. So ultrasound is mainly used to treat arthritis. Okay, now if you have swollen ankle, okay, so what do you put? You put ice packs. This will reduce the swelling as well as reduce the pain. Not only ice packs, you can also use hot packs. So for example, when you have a period, so you put hot packs on your tummy just to make it feel better. Okay, now this is another therapy which is called TENS, but I will explain it to you later. Now, this is what we need to look at. Biochemical methods. Basically, biochemical methods is drugs. Okay, so in this matter, it's actually painkiller because we want to relieve pain. So obviously, the drugs that we use are painkiller. Okay, now there are different types of painkiller, and it depends on what type of pain you have. Now, let's say you have a fever, or you have an inflammation, or you have a headache. You use paracetamol. This is a painkiller as well. How does it work? Now it works by blocking chemical messengers in the brain that tell us we have pain. Okay. It also reduces fever by affecting the chemical messengers in area of the brain that regulates body temperature. If you have a sensitive or damaged nerve, you would use tablets used for epilepsy and depression. Now they work by changing the way central nervous system works. This serves as the same purpose as paracetamol, but it's stronger. Okay, so ibuprofen, I'm sure you have heard of that. If you were not given paracetamol by the doctor, they will give you ibuprofen. It's almost the same thing, only ibuprofen works stronger. Okay, aspirin and ibuprofen. So inflammation, pain or fever, the same purpose as paracetamol. So work on the damaged tissue. Okay, it's just the way that they work is different. Okay, now if you have severe pain, they will give you morphine, they will give you opiates. Okay, this is stronger. It inhibits pain messages from traveling to the brain, preventing the pain signals getting to the brain. Now, do you remember gate control theory, where the pain you perceive depends on whether you open or closes the gate. Okay, so morphine or opiates, what they do is they close the gate so that the pain message do not travel to the brain, so we don't really perceive it as pain. So this supports gate control theory. Okay, now all of this is useful in terms of treating and managing pain. However, when it comes to this, these are some of the example. Morphine is injected, paracetamol tablets, antidepressants tablets, aspirin tablets as well. But paracetamol, they do come in liquid syrup for little kids when they have a fever. Okay, now, so all of these are useful in terms of managing and controlling pain. However, there are problems, which are side effects. Okay, now for some, when they take paracetamol, they have side effects of, let's say, I'm not sure what my side effects are, but let me talk about cough syrup. When you have your cough and you take your medicine, one of the side effects is drowsiness. Okay, now, but here, morphine, what does it do? It inhibit pain messages from traveling to the brain. It's really good. So let's say you have a C-section and you just finish C-section and you need something to relieve the pain, they will inject you with morphine. Now, what's wrong with morphine? Someone can actually become too dependent on it, so they feel like they cannot live without it. Okay, they need it, so they will become addicted to it. Okay, so this is how people become a drug addict from morphine. Okay, for some people. Now, here, so that is the biochemical methods. Now we are moving on to psychological techniques. Okay, now psychological techniques, there are several methods. One of them is cognitive strategy, so we change the way they think. Another one is behavioral approaches, so we change the way they behave. How do we do this? We use operant conditioning, classical conditioning, things like that. So operant conditioning, basically, if they feel like they are in pain, basically punishment and rewards. Okay, so behavioral approaches. But in the syllabus, we're only going to look at cognitive strategies. Okay, now we're looking at 3 methods under cognitive strategies: cognitive redefinition, attention diversion, and non-pain imagery. So the first one, cognitive redefinition. This method is basically the therapist or the doctors can ask the patient to alter their thinking to replace fearful or distressful thoughts about pain with more positive thoughts. So let's say I keep saying this is really going to hurt, this is really going to hurt. Now, and the doctor says, actually, change the way you feel. Now, if you say this is really going to hurt, so you're gonna expect pain. So why don't you do the other way? Okay? So let's keep in your mind, this is not the worst pain in the world, or this is all worth it. After all this, the pain will be gone, things like that. Okay? So with changing the way we see it, changing the perspective of pain, we will actually feel less pain. Okay, this is according to cognitive redefinition. This is the most common method used, attention diversion. So basically, we divert attention from the pain by refocusing or directing attention to something other than pain. Have you seen the video of where the doctor was trying to inject something to a baby? But before he does that, he does a little dance where he popped the needle somewhere along his leg and then finally just push it in and then inject the medicine without the baby even noticing it. Okay, so that's attention diversion. So basically distracting them. Okay, now for people with chronic pain, how do they distract themselves from feeling pain? Basically doing things that are enjoyable for them. Okay, so I don't know what the activity is here. So maybe painting with one of them. Maybe bingo for them because they like bingo. Sorry, excuse me, bingo. Okay, so attention diversion. I think this works best. The third method is non-pain imagery. This needs therapists. Therapists need to teach the technique to the patient. So where a method It's a method where patients focus on an image that is unrelated to the pain. So thinking of a warm, relaxing image. Thinking of your last vacation. What did you do here? What did you do there? So basically imagining something that does not relate to pain. Okay, so distract yourself as well. So but using visualization. Okay, so these three methods are the cognitive strategies. You can find more in your textbook. Okay, now what they say is it's only effective if you combine a few of this and not just simply focus on one, maybe just use attention diversion on this one patient. No, what they say is it's most effective if you combine a few strategies. Okay, so for example, Morley, Shapiro, and Biggs, they developed training programs which included imagery, pain coping strategies, basic attention management, etc. in their pain management. Okay, so they don't just use one, they use several coping strategies. So after 3 months, when they followed up, the patient reported less pain. Okay, so the pain intensity reduced significantly, and they said they use brief relaxation, use of imagery, and distraction. These are the three methods that they feel like are most effective and they use often. Brief relaxation, so basically just taking in deep breath, doing some meditation. Okay, they also use imagery. They can combine this together, so when they're taking deep breath they are imagining something else. Okay, as well as distraction when they are not doing anything, so they just basically do something that they enjoy. Okay, so that's cognitive strategies, okay, which is under psychological techniques. So we've looked at medical techniques, we've looked at psychological techniques. Now the last one we're going to look at is alternative techniques. So there are several. There are massages, okay, traditional. So if you have a back pain, so you go for a massage and somehow the pain goes. There's also yoga, as you all mentioned. Okay, there's also some stretches that you can do. Now here in the syllabus we're only going to look at acupuncture and TENS. Okay, so how does acupuncture work? So basically you just insert this is scary for me, fine needles at certain sides of the body. Okay, and then you twist it, keep twisting it. So this stimulates nerves under the skin and in muscle tissue. When you do this, the body produces endorphins, which is a pain relieving substances. That's why you feel like your pain is gone, because by inserting fine needles and then you stimulating the nerve, you release endorphin. Okay, and you know endorphin is good. Okay, so that's acupuncture, and that is how this is the medical evidence, the scientific evidence, that's how this treatment can work. But according to traditional Chinese, they feel it's something to do with their qi, the flow of energy in their body. Okay, but we're only going to look at this. Now, the second method under alternative techniques is simulation therapy, TENS. So basically it's just a small machine. It's something like your aircon remote control. Okay, so you press whatever, let's say you want strong, you want the time, how many minutes you want to do it. Okay, so you connect it to a cable which connects to an electrode, which is a sticky pad. It's called electrode. So basically you put it on areas where you feel like you have pain. Let's say you have a neck pain. Okay, so you put it there. Now, and once you switch it on, this will send electrical impulses through all the way to the electrodes, so through the pads, to the areas of body where you are experiencing muscle pain. So how can electrical impulses relieve pain? Because somehow it just can reduce pain and it can help relax. Something to do with electrical impulses that can help reduce pain. Okay, and then that's it. That is the last subtopic of pain, which is managing and controlling pain. I will see you again